I mean, I think, depending upon the disease state, there are therapies that have overlapping activity from a biologic standpoint, but they're not entirely overlapping. They're certainly individualized and specific to specific pathways, like inflammatory pathways. And so, how do we pick which one, and what disease state are we going to pick which one, right? And so, I mean, I think we're furthest along with regards to asthma and severe asthma, and that having been said, we still are having these really significant debates about, is this the same patient population, or are we looking at different patients, and how do we choose one biologic intended for severe asthma over another? And there haven't been head-to-head studies, and it's unlikely that we'll have that kind of data, at least in a palatable or meaningful way, for some time. And so then the question is, okay, well, how can we dissect this data that we have available to understand which therapy is going to be best for which individual? And I think that there is some information that is available. I think that maybe we haven't looked at things in a way that has been looked at in the past, and hopefully we'll start to see some of that. And I think adding to that, what we're seeing with regards to genomics and biomarkers and those kinds of things, it's really getting to be interesting. There's some posters, abstracts that are being presented that'll help, I think, to clarify what I believe is that these are, at least when you look at the severe asthma population, it is a highly overlapping group of individuals. And I think that when you look at the studies that have been done, they're not really all that significantly different. And there are some finer points that we're starting to see with regards to the different biologics that might help us identify which patient might benefit from one versus another. And I think a lot of it comes down to comorbid diseases. So, we see these patients with severe asthma that also have chronic rhinosinusitis and nasal polyps, or have atopic dermatitis, or have food allergies. And that, I think, will help us to say, okay, we may be wanting to think about this biologic versus that biologic because of the activity and how these different biologics affect the different pathways, and being able to dovetail the mechanism of action to work for both different disease states.